Hi friends, good morning. I am Dr. Umma Karadan, Chief Neurologist, Baby Memorial Hospital, Calicut, Kerala. So, I am going to present a brief idea about the Nipah virus, which has re-emerged after 3 consecutive years, maybe 2018, 20, and this year. And luckily, we have only one case this year, and all the contacts were reported to be negative for Nipah. That's a good news. That's it's a consolation for all of us. Then that 2018, myself, my colleague Dr. Jayakrishnan, we found a very interesting clinical scenario, in the sense that the patient developed fever, headache, pain of the limbs, followed by altered sensorium, led to coma. And when we found for the first time, that is on May 17th, 2018, we were called to examine a patient with this symptomatology by the critical care team, because the diagnosis was not obvious. So we found that this is an encephalitis, that's an infection involving the brain parenchyma. And we started the medication like cyclovir, steroids and other supportive care. Patient was already intubated and ventilated. We were again requested to see the patients once more the next day, and we found that to our dismay, we found that he has got differing neurological manifestation. He had a myoclonic jerks, especially on one side. There's a segmental myoclonus. He had a sweating on one side. He had a prominent autonomic symptom like high blood pressure, shooting blood pressure, tachycardia, and patient has got also irritability, restlessness, and all. And the same day we found one more patient with similar clinical picture, that is the aunt of the same patient. And we heard that his brother died 2 weeks prior to the present problem. And his father also developed the same problem. So we've speculated that probably this is a very, very rare virus with differing autonomic manifestation, cerebral involvement, brainstem involvement, and the heart was also affected. And that's a clustering in a family. It's a highly likely that this is a viral infection. And initially we thought that whether it could be rabies, whether it could be poisoning, whether it could be snake bite, whether it's a herpes simplex encephalitis, herpes zoster encephalitis, Japanese encephalitis, West Nile encephalitis. Then we found that these are all not, this can't be transmitted from human to human. There are hardly few viruses which would transmit from human to human and cause encephalitis. So we think whether it could be Ebola virus, because Ebola can give us to profuse bleeding, hypotension, and lung involvement. Hanta virus, that also cause renal failure and lung involvement. Then we finally conclude that this may be some form of probably a Nipah virus, and that is the history. Then we informed the government, and the government had a very quick action and started everything and to contain the virus. That is the history in 2018. All right. Then 20, we had one patient by my friend Dr. Bobby Varkey. He could promptly diagnose that condition, Nipah virus, and could contain even at the time. This year we have one more patient, and unfortunately that boy died, and all the contacts were reported to be negative. That's a great news. So that Nipah is a predominantly encephalitic virus with lung involvement. Unlike corona, the mortality rate is only 0.5 to 1.5%. On the other hand, Nipah has got a mortality, that's a death rate of 40 to 100%. Some studies 40% means 40 will be dead out of 100. 90 or 100 means 100 out of 100 will be dead, because in some report case from Bangladesh and all, 4 out of 4 died, or at least the rate was from 70 to 92% of death rate. That's the impact or the importance of detecting Nipah at the very early time, and to contain or to restrict the entry of further viral to the people, as well as restrict the mass movement from that particular locality. Everything, I think it's all being the news and all. So, but I would like to highlight certain points. One is that we should have a virology lab at hand, probably in the medical college or in the corporate area, or maybe a public-private interface where we can have a virology lab, so that we shouldn't run from pillar to post to get a viral study done, because even in 2018 we knew that we had to call the Manipal virology lab, and then we have to wait and wait. So this shouldn't occur. This shouldn't happen in the future. And all the encephalitis case has to be reported. That should be mandatory. So the government should ensure that all the encephalitis case should be highlighted. It should be reported, and they should have a screening, because we know that we get viral meningitis, viral encephalitis in a seasonal pattern. We get Guillain-Barré, we get multiple sclerosis. Everything will have a seasonal, like bleeding will have a pattern. So all the viral encephalitis should have at least a sample survey that has to be reported to the virology center. All right. Secondly, we should have a One Health policy. One Health policy means that the veterinary people or the veterinary medicine also should come under a holistic idea. Otherwise, there are many infections which would transmit from animals to humans, like a zoonotic disease. And we knew that this boy had a contact with goat, and I think is dead. Similarly, in 2018, that boy had a contact with rabbit, and that's what died. So probably these animals would consume the fruits or something like that, which is bitten by the bat, and they would get the infection. And when we were in contact with these animals or birds or something, it's highly likely that it can be transmitted. So all the infection or the abnormal infection or the encephalitic infection of the animal should be reported to the One Health authority, and they should be should be informed to the medical department. So I mean, they said this virus is there in the animals, or the Nipah is there, or Japanese encephalitis is there, or some other virus is there. So this should give us an idea that it's likely that this can be transmitted. Okay. Similarly, we should inform the people who are in the job of a toddy, like they put collecting toddy from the palm trees, from the coconut trees, like that. It's highly, because today only I saw one video, one bat is drinking the sap from the tree top, from the coconut top. That means that this is a very vital information to me, because that many people are in the habit of consuming toddy, what we call the kallu. So that means it can be infected by the virus. If the virus already has got a infection in the saliva, like Nipah or some other thing, we don't know, it's Ebola, yellow fever, or corona, or something else, we don't know, rabies. Everything is possible, so that this should be properly covered and should be properly contained. So the government should take action in order to help these people, so that it shouldn't be transmitted through toddy or some other forms. Okay. So with these few words, let me conclude here by telling you that the most important thing in prevention of Nipah is just like corona: hand washing, wearing mask, and keeping a social distance. Can also use a gloves if you want to, especially if you are visiting a hospital or if you're in a crowded place. Okay. Thank you very much.